It is reasonable but not necessary to establish a separate SMART goal for each cycle of a PDSA. Hillside saw that after the first week, patient visit times in general did improve, but not nearly to the extent desired. The team decided to retain the new schedule and the group telehealth visits and conduct 4 new PDSA cycles the following week. The team decided to leave the last day of the week with no new interventions in order to plan and assess the data for the next week. Since the team found that they had limited time to look at the data from week 1 in order to have a new intervention ready for the following week. Each intervention was planned for only 1 day, with data to be assessed at the end of the week to determine which interventions would flow into the following week. On Monday, the team tried physically relocating some objects and workstations into the hallways to be closer to the exam rooms and see less movement of staff back and forth from work zones to offices. On Tuesday, the front office staff were each given specialized roles, rather than each being responsible for a portion of any task that was required to be done by the front office. On Wednesday, the office manager was able to borrow an extra nurse from another clinic to test a hypothesis that additional nursing staff was required for smoother operation of the clinic. On Thursday, additional schedule changes and differences in the way patients were scheduled for the day were trialed. On Friday, only the interventions that had been elected to be retained from the previous week were retained, and the Kaizen team met at lunch to review the data and decide which of the interventions tried should be brought forward into the following week. Prior to starting clinic the following week, the office manager also held a brief meeting of all of the team to assess any difficulties the team was having with the interventions and get input from the team to assist. 4 new interventions for that week were also introduced.